And we now turn from Orlando to Washington, where we've got Luis Radnofsky. Luis, how are you?
All right, she's on the Afghan phone system. Maybe if Luis can pick up a phone, can we hear? All right,
there you go. Hey, Luis.
Good morning.
Good morning. How are you?
I'm good, thank you.
So tell us about these new consumer forms that are going to start in September.
Well, the healthcare overhaul law had a provision in it that consumers would be entitled to receive a summary of benefits from their insurance company. And what that's supposed to do, we got the final format for them yesterday, is in a sort of standardized way, not dissimilar to the nutrition label that you see on some food products, on most food products in fact. You should be able to have in Q&A format some sort of reasonably plain English explanation of what's in your plan, what it covers, all kinds of circumstances, like the sort of copay you might be expected to encounter if you have an emergency room visit, for example, or you access mental health treatment. It will tell you what won't be covered for you, and some other details like that.
So when I hear plain English, I mean, I always, there's some forms that are supposedly written in plain English, but even I can't understand exactly what they're saying. So what's your sense of who's going to be writing these plain English forms and how really plain English it's going to be?
Lawyers in the end are going to be writing.
And we know that doesn't go together, plain English and lawyers.
It is going to be still your insurance company.
Okay.
But the health officials, when announcing these rules, we're obviously very excited about them because as far as they're concerned, they think it's probably better than the full booklet that people get. They're also requiring that the plan send out a glossary to accompany the summary that will explain words like deductible, out-of-pocket costs, sort of things that not everyone is familiar with, and can make it more complicated to understand insurance information. Now, yeah, please.
Well, this is like an HMO FAQ, which makes sense. Now, I guess
that's not plain English. What are you doing with all those acronyms?
I guess there's some expenses to this. It doesn't strike me as actually being that much relative to the overall sort of scope of health insurers.
Well, the insurance plans had put the cost in the tens of millions. It is an administrative burden for them, and they've kicked a little bit about it. It might be cheaper than they'd originally expected because they now have the option of sending it out in electronic format, and obviously that would cut down somewhat. But they're still concerned, and their big concern is that by having to do this, they say that they could end up oversimplifying their explanations, and they could aggravate consumers who might ultimately feel that they've been misled.
Wonderful. Luis, thank you so much for joining us, and you can find full details on the website.